Hello, and welcome to a new edition of Education is the Best Medicine. Thanks for watching. And remember, community public access is your best bet. Believe Radio, 24-hour inspirational gospel music station. We broadcast live um, on the second and third Saturdays of each month around 2 o'clock. I try to be on time, but things kind of cause transition. Again, welcome. Thank you for the views on the last couple of shows. Appreciate you. All the people are watching. So the kind of thing that we're going to do now, because I'm going to be working with Dr. Lenora, is that we're going to probably be doing what's basically amounts to some media shorts, maybe 1 minute segments on question and answer. We're going to spread it out throughout the media universe, and then you'll be able to come here or to Dr. Lenore's channel for more in-depth discussions of the things we talk about. So I want to thank everybody very much on this journey with me. I want to thank Mark Jordan and Bernetta Fisher. Much principles of education, the best medicine. Without them, I would not be here. So I want to say that to them publicly and thank them both. And, part of the journey. Appreciate you. And also, Berkeley Media, Community Media, again, where I got my start, along with, again, always honor Chuck Johnson and Solby for allowing me the opportunity to talk and have a conversation around what it is that I do. I really enjoy that. So, Happy New Year to everyone. Again, it's January, and January is a kind of an interesting month. Of course, what I wanted to kind of share, and I think it's kind of fun for me, is quotes of the day. And just see if some of these ring with you. You kind of run with me. It says, do your best today. The best preparation for tomorrow is doing your best today. Act now. Change your life today. Don't gamble on the future. Act now without delay. Some other ones are be willing to change. We must be willing to get rid of the life we've planned so we can have the life that is waiting for us. I think that's really, again, some of these things ran true as I was preparing for the show. I just wanted to share them with you. It says, pursue your dreams. All our dreams can come true if we have the courage to pursue them. Keep moving. Life is like riding a bicycle. To keep your balance, you must keep moving. And that was just some of the quotes as I was reading in prep for the show, and I thought I'd share them because they all kind of ring true. And I think, we're always trying to build a better mousetrap, but what we should be building is a better us. So with that, I want to kind of look again stuff in terms of general information, and the one of the things was throughout January are multiple. They are have to do with cervical cancer, have to do with but we're going to talk about a lot of them, but one to kind of note that one of the things we're concerned about is poverty. And so this is in January, National Poverty Awareness Month. And I kind of wanted to share. So what constitutes poverty? Is in the annual expense of an individual making about $15,000 with a little bit of change a month. And for a married couple, it's $20,000 a month. I know some people are living on that now, but on the range of things, what would that constitute in your life now? What would that mean if you had to live on basically $16,000? Well, no, $15,000 as a single person and $20,000 for a married couple. Just kind of wrap your head around that, because I had to. And I think that also um, it kind of gets us into the issue around social determinants, food, clothing, and shelter, and what it means when we don't have enough of whatever it is we need to function. And uh, I think that a lot of the discussions are, healthcare .gov, because poverty is a health issue. It's a wellness issue. It's a sustainability issue. It's an access issue. So when we talk about poverty, again, 15,000 for a single person and 20,000 for a couple, then we're talking about how do you survive, pay your rent, pay utilities, pay for food, paid for gas. I mean, clothing, just the essentials, the quintessentials. And I think that that's one of the things that we need to have a conversation about as these things change. And I think that we also have to be comfortable with having a discussion around poverty, because it starts with us, and it starts with our willingness to have a discussion. And I guess some of the things, what are the roots of poverty? And I'm typing in now ATP chat, and in America. That's all right. In America. So, I think that we also need to be evidence based about this. We need to approach the literature. We need to do our homework, as I always tell the people I try to take care of. And if we do our homework, then we understand what is ahead of us. And so, some of the roots of poverty in America: economic inequality. The gap between the rich and the poor has been widening, leading to a concentration of wealth among a small percentage of the population. And if you kind of visualize these times now, is that not what the outgoing president, thank you, President Biden, having a discussion about? The majority of the wealth concentrated in the hands of a few. Education, a lack of access to quality education can limit job opportunities and earning potential. And what we're seeing now is a discussion on whether you need a degree or not. I guarantee you, those that are in that upper earning strata are making sure their children and nieces and nephews and grandparents get educated, or they go back to school themselves. So I think that it's a discussion about what we value, what are the issues, how are we going to look at this. Healthcare. In the state of California, healthcare can bankrupt you. You can become bankrupt because you cannot pay your medical bills. You have bill collectors and harassment. And so I really try to watch the people that I serve's dollars. You have to. There's nothing worse than getting a $400 or $500 lab bill for a couple of tests that you're not even sure what you got. So it's always important to educate people and discuss what's on medical panels and why you're ordering them and what you think it will significantly contribute to understanding your health or state of illness or wellness. Housing, the high cost of housing and lack of affordable housing and low income housing and accessible housing. I added those things on because I deal with this on a daily basis. Our discussion around can lead to homelessness and financial instability and poor health. Again, social determinants: food, clothing, and shelter, safety, where you can live, work, and play, economic access, those kinds of things. Systemic issues, discrimination and systemic barriers can prevent certain groups from accessing opportunities and resources. Example, redlining in California. Read the paper on social. Read the white paper on reparations. Far away now, because that's why I said about this. You may not necessarily get money from this, but you need to understand the historical context in which we face and are in this time, day, and end. So I think that understanding January as understanding poverty, understanding trauma, understanding all of the issues. And again, I'd like to thank the live folks who are watching. Thanks, Deborah. I spent great RN ophthalmology service over in one of the community public institutions. Been there for years. Just a super provider. Thank you. Government policies that do not adequately support low-income individuals and families can exacerbate poverty. So, and the workforce that works with them, because we're always functioning from a position of what I need to get you and what it costs, and is it accessible to us? Like transplants, So I think it says these factors are interconnected and can create a cycle of poverty that is difficult to break. Intergenerational poverty, intergenerational trauma. It becomes generational. Like prison service, generational. Like military service, intergenerational. On both genders. So, and this adds on to, again, if it's happening in the general community, the communities in need, the LGBT community, the communities of color, single men, single women, children without parents, all this equates to a circle. What we should do, be active, for at least a minimum wage. So we're hearing discussion about minimizing the minimum wage, about not raising the minimum wage, because again, California is an expensive place to live in, and all states are going to become expensive to live in. And they already are expensive to live in. So whenever states like California take on the minimum wage question and say that we should in this state employ people at a wage which can allow them to again, what's the landmark? 15,000 for a single person, 20,000 for a married person. That's not a lot of money. It can't be. So again, January is poverty awareness. Understand the level of poverty and what really constitutes it. And again, that's not a lot of money. Just as plain as to say. I want to say happy birthday to Martin Luther King. His birthday will be coming up. Usually January the 20th of each month. I want to thank him for his inspiration and for his dedication and for his lineage. And yeah, I know he's passed, but he is an ancestor to me. And he's someone that has a guiding light in my brain. I used to think he was an Uncle Tom, but I found that wasn't true. He and I've said this again publicly, he and Malcolm X were very good friends. The media plays them off as being enemies. So that's why we have to understand our history, or someone will write it for us. That's why we have to educate ourselves and be clear about that. There was a International Holocaust Remembrance Day, and I just think in general, the Holocaust has happened to all communities, all cultures, where it be the German occupation and murdering of Jews in Germany, or the slave trade and the trafficking of individuals starting in America in 1619. And just the whole idea of someone going through major trauma. America dropping the atomic bomb. Only country to do it. Okay. So it ended the war, but it caused a lot more problems. So again, Martin Luther King gets he would say, hey, continue to serve the community. So I'm gonna have to work tomorrow. That's what I gotta do. And he would say, love one another part. He would say, we're all the same, and to honor God and family, and stand for something. You know, interesting discussion around, believe it or not, dungaree jeans. And they're a type of gene that has a blue dye to it, probably African origin, but it's made $1 million industry. And particularly African women were the purveyors and did the dyeing. They still probably use the same technique today. You just don't know how powerful you are and what kind of legacy you carry. And that's why we have to be understanding. We need to understand and educate ourselves. Given that discussion, January is also Cervical Health Awareness Month. And it starts by saying not one single woman ever needs to die from cervical cancer. We have the tools we need to present this disease, so let's use them. Get involved, make a difference. Visit the National Cervical Cancer Coalition. Hey, and I'll start with the treatment before I start with the issue. Human papillomavirus vaccine at ages 11, 12, or as early as 9, Pap smear, starting at age 21. 3 options at 30 are to HPV testing alone, in addition to the HPV test, a Pap, or just a Pap alone for testing. A number of females die from undiagnosed cervical cancer. And cervical cancer is significant. This is from a GPT chat and some literature like the CCP. Cervical cancer is a significant health concern, and unfortunately, many women still die from it due to late diagnosis. In the United States, about 4,000 women die from cervical cancer each year. I like to repeat those kinds of data. In the United States, about 4,000 women die from cervical cancer each year. The number can be higher in regions with less access to screening, vaccination against human papillomavirus, which is a primary cause of cervical cancer. So in this discussion around women's health and women's access to health and healthcare access and care over a woman's body, as much as we're advocating for women to carry children, we should be advocating for them to be safe against cervical cancer. I think it's a decent trade-off. Not even a trade-off, because women should have rights over their body. Simple as that. No man should be directing the care of a woman unless he's the OBGYN, gynecology specialist, midwifery, and then it's a shared decision making. I see that a lot in the literature, that now decisions in clinical care have to have a shared decision making component. That's what I include in my notes. Because if you and I don't agree what we're talking about, what we need to do, then I can't do it because it's your body. Just like in medical information, it's your medical information. No one can dispel that information but you, and only the F that's been written and okayed by you. So early detection through regular Pap smears and HPV testing can greatly reduce the risk of cervical cancer. Vaccination against HPV is highly effective in preventing the infection that leads to cervical cancer. Of course, if you don't have a cervix, you don't need to be vaccinated, all right? But the bottom line is that those women with childbearing years, and again, this should be an arena where we should be seeing a drop in cervical cancer, because those women should be getting, those young girls should have gotten HPV vaccinations. The preventative for, I guess, my age range, 60 was the Pap smear. and the testing for HPV once we found that we could test for it. So around the life cycle, this needs to be something that, she's to be on our plates, on our arena. I know it has to be on mine. I have 4 granddaughters. And so that's why we have to implore and be okay with science and literature so that we can make a difference, that we can protect our young daughters, nieces, wives, mothers, grandmothers. So HPV vaccine, so prevention. Oh, hey, prevention is worth a pound of cure. That's what I understand. Prevention, HPV vaccinations. Vaccines like Yersinia and Cervarix protect against these types of, and these are particular vaccines they use for the vaccination process. It can protect against the types of HPV that most often cause cervical cancer. It's most effective when given to preteens, but it can also be administered to young adults. So we're talking about sexually active young folks and through the mid-cycle through up until your 40s, because after your 30s, you should be getting a pap smear for testing. So sexually active, definitely of childbearing years, and you have a cervix. It says it's most effective when given to preteens, but it can also be administered to young adults. And they're seeing they're regarding starting this. If I'm correct me, somebody. They're also being given to young men. Also, it also needs to be given and discussed with LGBT community, because even though you may have a different discussion in your brain about your sexuality, your organ needs to be treated the way it needs to be treated for screening purposes so that we can catch something. Usually, cervical cancer, then transgender person. Okay. Anyway. Regular screening, pap smear. This test looks for precancers, cell changes on the cervix that might become cervical cancer. If they are not treated properly, women should start getting pap smears about age 21 and continuing every 3 years if results are normal. HPV test. I think this is the game changer. This test checks for the virus that can cause these cell changes. It can be done simultaneously with a pap smear and co-testing in women over 30, and should be done every 5 years if both tests are normal. So it can be done simultaneously with a pap smear if both tests are normal. Safe sex practices, of course, using condoms, limiting the number of sex partners, reduce the risk of HPV infection. Quit smoking. And you can learn more about these subjects from www.nccc-onlinene.org. And that's the national, it's the American Sexual Health Association and groups, the National Cervical Cancer Coalition are there to help and talk and have a conversation. And I just want to, again, because I have to include all the communities I take care of. So cervical cancer can and significant impact on the LGBT community due to various factors, including disparities in healthcare access, discrimination, and unique risk factors. Here are some key points. So I do this in honor of the 2 men that got me into male medicine, Dr. Robert Scott, Dr. and Ariane James Home, Herculean providers, both gay men who were proud of who they were, and I was proud of them and to call them my friend. Health disparities, LGBTQ individuals, and I would say that this runs for the gamut of folks trying to access care, whether it be a female or the LGBT community. It's always an issue around access. Before you couldn't refuse to take care of someone. Now I think that's going to be okay. You'll say because of my religious or my preference, I don't want to provide care for this person, and it won't be an issue. I hope that isn't the case. I hope we will always regardlessly, open the doors in terms of healthcare to people, regardless of their gender or sex or race or national origin or opinion. Anyway, health disparities. Health disparities in the LGBTQ communities, that's lesbian, gay, bisexual, transgender, and just considering. Particularly those who are transgender and gender diverse often face barriers to accessing health care. This can lead to delays in cancer screening and diagnosis. Discrimination. Experiences of discrimination in healthcare settings are discouraged in the LGBT community, individuals from seeking care necessary. So just coming to the clinic office can be a traumatic experience for that person. They identify as Miss, and they keep calling him her. Not fair. And so it just discourages care. It discourages getting screened for care, and thereby delaying the diagnosis. And something again that's totally treatable ends up killing that person. Higher risk factors. LBGT injuries may have higher risk of certain risk factors for cervical cancer, such as smoking and infection with HPV. Additionally, lesbian and bisexual women are less likely to receive HPV vaccinations and regular PrEP tests compared to heterosexual women. One, because they say they don't need it. That's not who they are. And I always say, I know that's not who you are, but this is a different part of you that we need to make sure is taken care of. And I respect the other 3/4 of you that says this isn't you. So, and that's the conversation the clinicians have to have, as opposed to going, okay, you can leave. Anyway. So, mental health. The stress of living as a sexual or gender minority can contribute to mental health issues, which may further impact on overall health and cancer outcomes. Lack of data. There is lack of comprehensive data on cancer incidence and outcomes, specifically for LGBT individuals, making it difficult to fully understand and address these disparities. And in what we're moving to now in terms of less data, less education, less documentation, or the dismissal of particular communities because of their sexual preference, we're in trouble. I hope that isn't the case, but we're in trouble. And we just have to, well, the answer, of course, is improve access, reduce discrimination, and increase awareness about the importance, again, of cancer screenings. It's crucial, just absolutely crucial in addressing disparities. Again, this is from the LBGT component of this. I want to thank you for watching, for listening, for checking us out. Believe Radio is up for some award, and I tried to get on the website, but I'm gonna have Adam put it on the website so we can go out and vote for our favorite station, us. And speaking of us, January is also National Blood Donor Month. The month of January is designated as National Blood Donor Month in the United States due to holiday celebrations and inclement weather and cold in the flu season. We are experiencing at risk for increased blood shortages. This is key. Many lives were saved by the ability to access blood. If you're interested, Dr. Charles Drew, one of the Herculean physicians in blood products and transfusion. Brilliant man. I don't know if this is urban legend, but I think it's true that he died on the steps of a hospital because they would not admit him as an African American physician. Hard to think, but that's true. I may even search that. Because you always have to have facts, and as opposed to garbage. Did Charles? I asked, how did Dr. Charles Drew Die. DIE. That'd be interesting. So we need blood products. We need you to provide them. And we just need to have it done. Here, Dr. Charles Drew, a pioneering medical researcher and physician renowned for his contributions to blood banking, died on April 1st, 1950. I was still a twinkle in my mother's eye. He was fatally injured in a car accident near Hall River, North Carolina, while traveling to deliver a lecture in Tuskegee, Alabama. Despite a persistent myth that he was denied treatment due to his race, it is documented that Dr. Tree received timely and professional medical care at the Almas General Hospital, but the severity of his injuries, notably chest and leg injuries, led to his death. It is tragic irony that man who contributed so much to the field of medicine and blood banking met his end at the result of a car accident, was especially given his groundbreaking work on preserving and storing blood, thus saving countless lives. Charles Drew. We have to stop urban legends too. Even though we want to believe in them and love them, we have to kind of like find out what the truth is. Lie's the truth, truth's the lie. So more than 50 years ago, on December 31st, 1969, President Richard Nixon signed a proclamation designating January as National Blood Donor Month. The monthly observance is intended to honor voluntary blood donors and to encourage them to give at a time when more critical resources need. One of the maybe major folks that made me aware of this was Nurse Dee Flanagan, Administrator Dee Flanagan at Kaiser Hospital, and who gives blood on an ongoing basis. Thanks. The monthly observance is intended to honor voluntary blood donors who encourage blood to give at a time when more of this critical resource is needed. And one day, 29,000 units of blood are needed in America. A unit of blood is approximately 450 liters, or about a pint. And it just says do what you can to help to provide this life-giving fluid. And the Red Cross definitely appreciate it. America should appreciate it. We do appreciate you for giving if you do give. Much is needed, much is required. So much is given, much is required. Which got me into in January, it's National Codependency Month. What's codependency, might you ask? Do you feel codependent? Do you feel needy? Do you feel you're not being needed enough? Is it excessive? Can you handle it? So that's apropos because January is codependency awareness, and it's we have about half an hour left. I want to thank you folks for tuning in. Appreciate you. Believe Radio 24-hour inspirational gospel channel music. Shows go to YouTube, and again, I want to thank my collaboration with Dr. Michael Noor. We're doing some minute health spots over the A area, and we've gotten a roadmap for it and going to try to see if we can push it forward. Terry West, thank you very much. So National Codependency Awareness Month. National Codependency Awareness Month is in January, and I guess because it's the first month, so right, you can be just learn how to be either the codependent or dependent all the way through to December, right? It involves around helping those who might be caught up in a codependent relationship. This is important because codependent is not healthy and may have an impact on one's mental health. Most importantly, codependency greatly affects one's ability to stay happy in relationships. As a result, National Codependency Awareness Month has established to guarantee that people continue to live happy lives, make an additional effort to support folks who are codependent in this journey by raising awareness. And the question are, as we talk about this, are you a codependent, or are you a dependent, or you really don't care and I don't know what she's talking about? So, what is codependent personality? A codependent person plans their entire life around pleasing another person. Now, the question is if you like it or don't like it, or if it's causing you more household stress, or it just makes your day you wake up thinking that, then, okay. Where does codependency come from? Codependency originates from one's childhood and the circumstances one faced. So we always talk about the, you know, intergenerational trauma, how impressionable young minds are, and that kind of impression leaves you with your personality for a lifetime sometime. And I want to thank my son Kenyatta Pearson. He and I had a 4 o'clock talk in the morning. I was getting ready to go to work too. You know, your children call you. My son calls me right when I'm getting ready to go to work, right? And we had a good talk though. So my discussion around that is don't be too busy to talk to your kids at whatever time, because whatever you're doing, it can't be that important as talking to them. I'm a little codependent on him. So that's what kind of started this conversation. Where does codependency come from? Again, child trauma, child issues, intergenerational trauma. So here's the definition. According to Webster's dictionary, codependency is a psychological condition or a relationship where one feels the need to be dependent on or controlled by another. And sometimes that could be good or bad depending on what's going on. I guess the discussion is what's too much or what's not enough. However, it's not a mental illness, but a perception of life that is based on one's childhood. Clinical literature states codependency develops when a child is exposed to a dysfunctional family, join the club, so this could amount to anybody. And so when you hear that, oh, he's so crazy, possibly. I think we have to get more used to the fact that most of us grew up in dysfunctional families than functional families, and how that shaped our personalities. And we live with our dysfunctionality because that's how you do in family. You don't. I couldn't say to my brother and my sister, "Hey, go back." So, and believe it or not, they are the most lasting and loving relationships in families. Even though we live crazy sometimes, So, however, it's not a mental illness. Clinical literature states that codependency develops when a child is exposed to a dysfunctional family where they're exposed to abuse and neglect by the parents. So I guess whippings was abusive, huh? Yeah. While in sociology, codependency is a concept that, I think that African American codependency and white codependency have to be different. Because when you're privileged and have things, then your codependency has to be different for someone that doesn't always have everything, and it's a matter of survival sometimes. That's just my thought. This is where the codependent individual tries to make up for the self-destructive tendencies of others by suppressing their own needs. Self-sacrifice, ignoring one's own feelings and emotions are key to such a partnership, because the codependent person is continually looking for acceptance. Any criticism sends them into a tailspin, and codependent relationships can develop between lovers, friends, siblings, parents, co-workers, and others. Okay. Since codependents tend to be put others on a high pedestal and ignore themselves, they have a low self-esteem and complex personality where their own needs come last. Now, I've been saying this for years that, if you don't take care of yourself, you can't take care of anyone else. And I think it's apropos that we kind of understand that and not be selfish about being selfish sometimes for yourself. That's hard to do because I believe African American culture says that we give and give and give until we can't give anymore. And then when we give, we come back and give some more. I think that's the pain of African American women that voted for, and we all voted for her, Kamala Harris, and they were summarily dismissed. So that's painful. And the concept of that is African American women have given so much to American society. He has built, has suckled the children, has carried them on their backs, have cried and wiped their eyes, and then had children, then worked, and then all the things that they had to do to survive and for their family to survive. So I think there's a different kind of codependency that African Americans from the 1619 persuasion have. So here's some. So it says that codependency is a circular relationship in which one person requires the other, who in turn needs to be needed. How many of us need to be needed? I think all of us, right? Says such relationships can be extremely toxic, hence they need to be identified, and codependent person must receive professional help. You wonder why, mothers can take so much. Sometimes, man, and they still okay. As far as you can understand, okay. So that's a level of loving so much to stop loving yourself. So I've asked people I take care of, people around me, people I care about, to stop doing that. Can't take care of yourself, can't take care of anybody else. Be okay with that. Codependents are sensitive. Codependents are generally more sensitive and their feelings are hurt easily. I guess that's maybe true. Yeah. It's like, I guess I had to understand that in medicine, everyone doesn't or does not want or does not like your care. It's not personal. It's just not what they're used to and not what they want. Responsible ones. Codependents are actually the glue of the family and the ones who get everything done. Our mothers, my mother, my sisters, a majority of females in the world that I know, my co-workers, women in general. That's why I believe that we have to be actively participating in the right for a woman to have rights over her body and her care and who she is. Problems with codependency. People with codependency usually have anxiety, are depressed, and have post-traumatic stress disorder, which is reliving of the trauma over and over and over again. So, codependent Americans. 90% of Americans demonstrate codependent behavior, and the other 10% are lying. Codependent Americans. 90% of Americans demonstrate codependent behavior. I would say this past election bore that out truly. Looking for the knight in shining armor, the white man, they're going to save us from all this and punish the villains and make us strong again. Thus, make America great again. Codependent people. 40 million Americans, primarily women, and I'd say primarily men, and I'd say primarily human, and I'd say primarily children, are codependent. So how are we going to observe codependency, man? Research codependency. Hey, learn about it. I want to find out more about codependency. Conduct research on the topic and find out why people become codependent and how they can be helped. Definitely. This is a discussion about self-care. It's a discussion about mindfulness. It's a discussion around putting yourself first. It's the discussion of self-love, which is in January. Wow. Hopefully we'll get to it. Get therapy. Get help. It's not healthy. Even in choice, you need to kind of be able to back away and say, I'm okay. Because it can be addicting. It can be really, really, really addicting. You get an endorphin rush of just making people happy, right? Good Lord. So get therapy. If you believe you're codependent, it's time to face your anxieties and seek treatment from a professional who can help you make sense about this. Yeah, you have to have a really professional who's culturally competent, understands the issue around trauma and how you are codependent throughout the issue, understand the differences in economics. I do believe there's a difference between white codependency and African American and people of color codependency and children codependency. I thought I was codependent, Mama. I could not go anywhere without her. I remember waking up sometimes and running to her bed to get it until my stepfather said, "Well, I have none of that. Go get back to your bed." That did it codependency. It's good for me too. It's time for me to stop running. Thank you, Brittany Hester. Good seeing you. Good hearing from you. Appreciate you. So, and that brings us to, ability to make sensible decisions. This is National Slavery and Human Trafficking Prevention Month. And it's from the U.S. State Department. And so, hey, I'm against all slavery and human trafficking. So anytime we can bring light on that, not only just from the here and now, but from a historical concept, I'm all aboard on that. I think the discussion, well, what people want to have now is related to the same issue, but just different contexts. Certain contexts that they don't want to have a discussion about. So January is National Human Trafficking Prevention Month. Every year since 2010, the president had dedicated the month to raising awareness about human trafficking and to educate public about how to identify and prevent this crime. I think that's important. I think that we need to, because a lot of these are young females, young men, LGBTQ young. And with the LGBT, it's high rate of suicide. And, hey, across the board, and that's going on, to high rate of suicide. Because they feel like they've done something. It was their fault. And this act was like 20 years ago. The Trafficking Victims Protection Act of 2000 was enshrined in the law by then President Obama. Thank you very much. Every January since then, it's been approved to continue. So we'll see what happens this year. There are estimated 27.6 million adults and children subject to human trafficking around the world, including the United States. And I would say that 25 million plus were lost in the Middle Passage on their way being tracked as slaves, become slaves in America. The numbers are still staggering, still scary. There's still too much cognitive dissonance, which means that you kind of justify your behavior towards somebody, and so you can do what you want to do to them. And it's a shame. I first heard the term from Dr. The woman who wrote post-traumatic stress disorder, and basically it says that it said cognitive dissonance is a, let's see, here we go. So cognitive dissonance is the mental discomfort that results from holding two conflicting beliefs, values, or attitudes. In America, it was slavery versus freedom. So that when you hold those two conflictual beliefs, then your Jefferson can have Sally Hemings as your concubine, right, on the plantation. Sally Hemings is an interesting woman. Read about her. Read about her in Jefferson and why that story isn't told the way they want to tell all the other stories. Because it doesn't paint them in a pretty light. So it occurs when a person's actions or thoughts go against their values or beliefs, leading to a feeling of uneasiness or tension. Witness this last election, but they ain't uneasy about it. They were not uneasy about it. They knew full well what they were doing when they walked in and voted. White women elected him higher, at a higher level. And when you look at slavery, white women were slave owners. It's unfortunate to say, but that's how it went. So that's a discussion. So again, but some of the things that can be done to prevent trafficking, neighborhood watch and identify folks. There is a hotline for victims of human trafficking. You can call a 24-hour national human trafficking hotline at 1-888-377-888. And if you believe someone's being trafficked, again, that's the number. Give them a call. Let them know. You got to leave your name, but just contact. This is the situation. This is the area. Please take a look at that. Again, I want to thank President Obama for his leadership in signing that Hallmark Act. Which, boy, in January also is National Stalking Awareness Month. It's from the Office of Violence Against Women, U.S. Department of Justice. Have you ever been stalked? They say I'm too ugly to be stalked. But there are a lot of women that have been stalked. A lot of my patients have been stalked. Had to put out restraining orders. All of it. It was really, really scary. So that's why I wanted to talk about this in January. Do you know that 80% of stalking victims report being stalked through technology? New age stalking now. Before it was just hanging out on the corner, watching somebody walk, or being in the same movie or the same lunchroom, or whatever that behavior was. Ending up opening the door for them on their car. It's bizarre stories. But now technology plays a role in stalking. It says 40% of stalking events are stalked by a current or former intimate partner. It says, and I asked the question, what are the numbers of African American women of color who are being stalked compared with white females? And this is from ChatGPT. It says the statistics on stalking, and it's the pack on different racial and ethnic groups, and we'll define stalking, but somebody following you that you don't want, or access to you that you don't have. You pop up in there on your email or on your iPhone, and you tell them to stop, and they still do it. Like trying to block somebody, and they just reset themselves. Statistics on stock, because this can be prevented. Men have to get it together and quit tripping. When women do it too, but mostly men. This is a men's thing. It's a control thing. It's a power thing. Statistics on stalking and its impact on different racial and ethnic groups, including African American women, women of color, and white women, can vary based on the specific studies and the sources being referenced. However, several key insights are available from the National Service and research this topic. National Intimate Partner and Sexual Violence Survey, according to the U.S. for Disease Control and Prevention data. 1 in 6 women and youth have experienced stalking at some point in their lifetime. African American women and women of color report stalking at rates that are similar or higher than white women, but there are variations depending on the specific group being studied. And in other words, the women that are reporting the 1 in 6 are being stalked. They're being stalked. Simple as that. African American women research results that African American women's many experience stalking at rates comparable to or higher than white counterparts. In other words, women of color, African American women, are being stalked more. When you talk about income and race and gender and ability to get somebody to stop, because a lot of women don't have an option. Miss Bradley, you're going to come on the show one day and we're going to talk about this stuff in depth. You're doing some Herculean work. Thank you very much. Just a great warrior queen. Thank you. African American women research suggests that, again, women of color are more likely to be stalked and not reported. I know that. To get the data. Because they want peace. Sometimes it's their husband, their partner, their ex-lover. They don't want to get them in trouble. But it's moving to violence. My grandchild was shot 4 times in the chest by a friend who knew her. This was a gang affiliation. Yeah. So, this can be linked to factors such as socioeconomic status, experience in intimate partner violence, and racial disparity in the criminal justice system. So Black women aren't believed, African American women believe. They go to the system and say, this person is messing with me, he's stalking me. You've seen a couple of these. I'm always kind of thinking that a number of the murders that we've seen with family members, groups of family have been through domestic or, intimate partner or people hating on that for not being with them anymore. Maybe something as simple as that. If it reflects any things about gun violence and the use of a gun and shooting a partner, particularly female, the person that does it usually hasn't had any criminal background. He knew the person, she knew him, that kind of thing. That's what's shocking about this kind of data. So that's why I bring up stalking. Women of color, which include Latinas, Asian American women, Native American women, and other, can face disproportionately higher rates of stalking. For example, Native American women report alarming high rates of stalking and often higher than the national average. Research from the National Institute indicates that 1 in 2 Native American women have experienced some form of physical violence and stalking over their lifetime. And that's if they're lucky, because what has happened, a lot of Native American women are being just yanked off the street, like a lot of young African American women being yanked off the street, like a lot of... Gotta stop. They're taking babies. My baby was murdered. You can't control an adult. And if they don't like you no more, then tough. They ain't gonna like you no more if you kill them. Take away the baby mama. Latina women may also experience higher rates of stalking and domestic violence. And then you talk about the culture change, the language change, the dependency. You come from Mexico to get here, and the guy that you with now wants to be a jerk. Latina women may also experience higher rates of stalking and domestic violence, with studies indicate the cultural, economic, and immigration status factors can influence stalking experiences and likelihood of reporting such incidents. So they want to stay in the country, and now they really want to stay in the country because they're talking about deporting everybody. And doggone it, if she is getting beat up, she can't say anything. To summarize, the data suggests that African American women and women of color may experience stalking at rates comparable or even higher than white women. The basic figures can be very dependent on population study, underreporting. So I think it's underreported. I think the black women, as I understand them, would say, "Look, I don't want to hassle. Just leave me alone." And that's like silence is golden. So you gotta report, you gotta talk about it, you gotta take a family member, you gotta let folks know. Intimate partner violence victims who are stalked are 3 times likely to be murdered by the intimate partner victims. I'll read that again. Intimate partner violence, women or folks that get beat up by their partners, they are more like when they're stalked, they're 3 times more likely to be murdered by that person. 3 times. So in other words, when she dies, they go look for her partner. They already know who to look for. And he's sitting at home, having a beer, watching TV. I don't know if he's having a beer, but a lot of these gentlemen they went to the home and got the men out from the home or from where they were at. And in the stalking environment, it's a lot wide range of tactics, more likely to use weapons and use them in a lethal manner. I'd add that. Or more likely to fall through on threats of violence, definitely. And so, hey, action. The day of action for stalking awareness, to talk about it. So stalking is, here's the definition. Stalking is generally defined as repeated and unwanted attention, harassment, contact, and any other course or conduct directed as a specific person that would cause a reasonable person to fear for the safety or the safety of others or suffer substantial emotional distress. Reasonable. I've told this guy like 100 times, that's not reasonable. I told him like twice, I don't want to talk to him anymore. He still is calling. He's in the hallway. He's outside my door. He's in my face. He negated the restraining order. 100 yards, length of a football, I understand. Again, stalking is generally defined as a pattern of repeated unwanted attention, harassment, contact, or any other course of conduct directed at a specific person that would cause a reasonable person to fear for their safety or the safety of others or suffer substantial emotional distress. Again, maybe the person and the family that's murdered. Scary. I think Ms. Hania Bradley knows about a lot of this more data than me and could give us some insights. We'll see if we can get her on. So, what do you want to do? To learn more about stalking, check out these resources. Legal information on abuse using technology is Women's Law, a project in EDV. What do you do if you're being stalked? SPAR, SPARC. SPAR is a real big organization in this, as I was doing my literature search. But they don't help with, they just help with solutions and discussion with you. They are not therapists. They try to get you where you need to go. Which they should be that, but limit the money, right? Limit the money and limit the outreach because everybody don't need to be outreached. More stalking and a risk assessment is the cohesive control group. Safety Net's own survivor tool kit, and a lot of these things they have tool kits and all that kind of stuff. And again, I want to thank you for listening and coming through and showing up. Appreciate all y'all. You've always been a part of the experience, and it's be kind of blessed, because we all don't have to be here. We all ain't got no survival skills. We all, for not the grace of God, then So I say we are very blessed. And again, we talked last week about vaccines. That's what's running right quickly. alcohol use, and what's one drink too many. Probably all of them, but my colleague would disagree with me, Dr. Lenore. I think that we have to be okay with being okay, and that starts the healing, because we have to heal. We can't consistently continue to cry about the wound. We have to let it heal and let it scab, but that takes a lot of work. I think stocking kind of hit home for me because, you know, um, my mom was stocked. As I think about it, I put all the stuff together, and her closing the door and locking it and just being stocked. You know, um, and I think it's incumbent on men to address that. And when I mean address it, it means that it's not an option for it to happen to your mother, to your sister, and you ain't got to go bump chest with the person, but you have to make that person aware this is not acceptable and to put it in a legal hand. Don't make it personal, because the personal stuff is what gets you killed. The you taking it into your own hands is what gets you killed. And I want to send a mention out to the Janelle Hester and the Hester family, and all of the senior Hester was a major minister. He and his wife, Mother Hester, created a dynamic, large, beautiful family, and they would always say, I think the father would say, you're gonna have to live with us. You're gonna have to live with your family. You're gonna have to always love them and honor them. But you're not to be mistreated. He would say that. So I think he's just a Herculean. He was the head of the Ministers Association. He was just doing so much for us as a community. And I think that some of the stuff I've been reading, kind of looking at, it says, in terms of men's health, just as a side, it says researchers explore health promoting behaviors of African American and Black immigrant men. And that'll be for another time, because it's time for us to get out of here. I want to thank you guys for watching. I appreciate you. Love you all. It's been a great experience. And Happy New Year to all of you. May all your wishes and dreams come true. And I want to say that, we're just getting started here. We're just touching the surface of what this is going to be and what it should be. And it's like I say, it is what it is. I want to thank all you for being who you are, and have a great month of January.